Any feedback from one or maybe two quick points from here, things that you were raised at your table of potential interest?
I mean, we covered lots and lots of different things, so rather than do a...
Yeah, just you know, a couple of
an
things that maybe surprised you, or...
I'd say the things that kept coming back time and time again, we talked a lot about sort of communication and language and whether there could be more awareness of things, and that could be something that could be looked into around health systems, so even things like dental care, when, you know, we were talking about that specific topic. So we mentioned that. And I think the other thing that we talked about a lot, again, about integrated care systems, is the sort of pathways. And again, looking at those and exploring that more, because that seemed to be coming back to this idea of prevention. So where the pathways for care, you know, fed through the whole system. So that were two themes, I think, that came up time and time again.
I think there's a really interesting piece of work to be done about, as pathways are developed, that they're co-produced. So I was at a meeting a few weeks ago, and I won't say what or where, because that might reveal what... But suffice it to say, they'd come up with a major change in pathway around discharge, and it was only after it had all been written down and determined that they were talking to the general practitioners about this new pathway to discharge, and they hadn't involved any public. And I'm afraid I was the unpopular guy that said, hang on a minute, but, you know, this isn't just about what is determined on a ward. If you're going to discharge out to the community, it has to be integrated. So I don't know whether they're going to go back to the drawing board. I suspect not. I suspect because of all that work that's been done. But there's maybe some interesting work to look at how we can pioneer properly co-developed pathway changes that are integrated and are co-developed. We just published something in the BJGP about long COVID and other chronic conditions and what integrated care would look like from a patient perspective. But I still think that's based on a Delphi piece of work. But there is some work being done, but that's an interesting and important idea. So systems, but systems need to be co-produced. Not entirely bottom up, not entirely top down, but something that integrates the clues in the word. It's a bit like clues in the word for ARCs, collaborative. The clues in the word for integrated care systems. Can we go to the... It's great, this. So, Catherine, are you speaking for your table, or is somebody else going to do a couple of points back? I'm also helping the step count of the two microphone carers. It will be maximising the steps between the tables.
Right, so I think we had a couple of cross-cutting themes, which were about deprivation and lack of access to services and lack of early intervention across both the subjects that we were looking at. And
well, I mean, the specifics can come out later, but as a theme, early intervention is one of government's, you know, that's their number one in their list of 3 research questions, is early intervention, early recognition, and how we get that better. And you're linking it, as they do, to health inequalities. So we need to start thinking about, when we're looking at those problems, about what should we be identifying earlier or preventing earlier, and how can we maximise the penetration into those most vulnerable groups or those areas which have got least resources.
Yeah.
So have you got any sort of illustrations of that concept from your table?
Yeah, so the second issue that we talked a lot about was about how the research questions have to come from the practitioners on the ground, not from the top down. So it was sort of linking those things together.
The gaps, the questions, converting into a researchable question is where the academics come in. But absolutely.
Mm-hmm. Yeah.
What matters if you're going to lead to implementation has to come from that co-production. Oh, we've done that one. So there you are, actually. Go on, Deborah, you've walked that far.
Hello. Hello, everybody. We talked about linking together dental health with children's health, and we identified an area of premature babies. where they're given sucrose, is that correct? The person, yeah, and that there needs to be some clear education with parents on that particular area, and any research in that area with evidence that it was needed, it would become apparent, and that needs to be acted on. So that was a specific example that we had to bring those two areas together. The other one was there was an opportunity to facilitate collaboration between the neonatal units in Lancashire, because there's real inequalities and the differences in some areas of service delivery, and the ARC could play a role in improving that, and that's ready to be delivered.
So if anyone with that idea is coming to our theme this afternoon, please raise it and we can pick that up. Over here. You
Thank you. We had quite a wide-ranging discussion. Joe was talking about the 2030 priorities from Alder Hay, with quite a broad brush around reducing inequality, so that fed in with sort of Ben's work around economics. But we also talked about air quality and asthma, and about participation in research and it improving outcomes for children. Then that followed on to involvement and sort of community distrust in research, and how, you know, if we could somehow combine co-production and involvement with young people and families into clinical research and local authority priority setting, that might be a way that we can address that.
Thank you. Paula's table.
Echoing some of the things that Selena's just said, talked quite a lot about the commonality of interest that we had around the table, even though at first, through introductions, the group seemed quite diverse. Talked about the broader social determinants agenda, sort of aligned to the resources we've already got in ARC around For Equity and HIAT, and how maybe they could come together and coalesce around a housing and health agenda. So it would be children and young people's focus, but with an interest in sort of connected things. And we thought that might align and engage and involve some of the people that aren't here today who we would want to be here. We talked about opportunity for races. You know, we're really strong methodologically, and how do we use some of the framing around housing and health to support some of the races agenda that Joe and colleague are working on. Talked quite a lot about data and digitisation in the children and young people's space, and what that meant for the research agenda and the implementation agenda.
Okay, because of time, so I facilitated this table. People said, what dental care? And for vast majority of people, vast numbers of people in the population now, there is no effective access to NHS dental care. It's impossible to get. And I don't think that's necessarily just an inequalities issue. I was talking to a colleague, so senior professional, can't get access to NHS dental care either. And it's not easy to get private dental care at the moment. But so definitely an agenda around, and it's not just about teeth, it's also about its impact on other areas of health. And the impact of dental caries, and once you've got dental caries, that it continues and it worsens. And so early intervention, early stopping, how do we prevent dental caries in the first place? How do we improve infant feeding and nutrition, which links to the sucrose, because babies should not be getting sucrose in any shape or form, except perhaps through a drip. This table.
Thank you. So, yes, in terms of both of the topics, dental public health and the children and young people, we thought around the existing work that really we need to map and share what we know is going on in this space, so that we can at least prompt discussions and conversations about commonalities and also where the gaps are in research. Similarly, we had a question, similarly we think around the inequalities side, learning disabilities and autism. There are particular barriers for for people in both of those topics. What else did I have on here? Young carers, we thought, were a growing group around in the children and young people. We don't know if we're already doing anything in that area. And then around additional areas, we had quite a few questions, but narrowing this down to two, local authority social care, can we convene meetings or maybe an ARCFEST to specifically attract people from local authorities and social care, and also around capacity and ensuring that as an ARC we can buy people out of member organisations so they can participate with us.
Oh, it's me. Similar to Darren, actually, as I often am.
That's fine then.
The what? Sorry.
Oh, sorry, go on, carry on.
Oh, go on. So we had around sort of like we had two disparate things, didn't we, about children and young people, and then the dental health. But actually, the issues raised by Alex about the fact that he often sees kids who've never actually brushed their teeth ever. So combining the dental health with children and young people. There was also, from the opposite end of the spectrum, dental health within care homes. That was raised. Also something...
We have got a project on that.
Sorry?
We have got a project on oral health in care homes.
Okay.
It's completed, yeah. Sorry, carry on. But there has been a project on that, but I think we could go back to see about implementation of it more widely.
Yep. There was wider things rose around sort of promotion of healthcare system literacy and the fact that people who need to, particularly the people who most need to know how to navigate the health system, don't necessarily know how to do that. And separately, I think we may have a new member organisation, so I'll try and put you in touch with someone.
Great.
Okay.
You've reminded me of a couple of national things. So one of the things that came up at the national meeting was, because we're talking about widening engagement and research and diversity, is in order to do that, there's a cost. So at the moment, if you want to do translation or you want to do signing or anything else to enable wider communities to take part in research or get engaged, that's quite expensive to do. So I was making the suggestion maybe NIHR could think about producing a central resource which could translate materials into different languages, which could offer a signing service so that you could widen participation that way rather than each research group having to go off and resource it separately, which is very expensive to do. So there are costs involved in achieving our aims of co-production, of diverse engagement, of going to different groups, harder to reach groups, which I'm not sure, though they say it's a fantastic thing to do, when you produce a budget that says how much it costs, somehow people start to step back a bit. So that's a challenge that we're trying to embrace, or encouraging them to embrace centrally, but an important point to make. And finally,
It's me.
Yeah.
Okay, a lot of the issues have been talked about already. In terms of children, young people, we believe that a whole systems approach is needed. It's not just children, young people, it's their families, their carers, their guardians. We talked a lot about mental health issues for children, young people, and also educational inequalities which are impacted upon by health inequalities, for example, holiday hunger, the impact of the pandemic on children's mental health, and also a lot about the influence of social media on children's mental health and also on their health generally. You know, we're swamped by you know, this vaping thing that's going on now and all the sort of advertising for unhealthy sugary drinks, etc. And similar sorts of issues in terms of dental health, so cost, the influence of the environment again, difficult to access. There aren't any NHS dentists out there. And some people don't have access to the internet to even access emergency dental care.
Yeah.
And the questions, we thought, we've come up with some very good ideas for research questions. So research into transitioning from CAMS, child and adolescent mental health, to adult mental health services. The impact of artificial intelligence, how that might help with mental health management. research into the influence of social media on children, young people, in terms of vaping, smoking, fast food, etc. Fluoride, what are the benefits of fluoridation? Some research around that. Research into the cost benefits of, you know, we used to have NHS regular dental care, didn't we? So what's happened there? Can we look at the benefits of having regular care as opposed to people are now accessing emergency care or taking out their own teeth, as somebody told me today, which is quite awful. And maybe a survey to explore the levels of access to dental health care across the northwest coast, something around that. So we've got other things here, but conscious of the time.
Yeah, I was going to say time is our enemy here. So unfortunately, that's really great ideas coming up. So hopefully those have been collected around the table by the facilitators. We can feed that back in. We've got a few minutes left before we go to the marketplace, so maybe just 10 minutes on thinking about the how. Any sort of great ideas that people can share about things that they've done that they hadn't known about before but has made a real difference and really helped. We can collect some of those ideas, or organisations or individuals that were aware of any particular methods that they found really useful. So we just maybe collect some of that information if we can around the tables.